Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Today I wanted to talk to you about the Form 1010EZ. This is a VA form. There's thousands of VA forms, but this one's specific to your application. Well, this is the application for your health benefits. So once you get service connected, right, on the VBA side, Veterans Benefits Administration side, your health benefits don't automatically kick in. You need to actually apply for those too. Now, there's other ways into the healthcare arena on the VA side that don't require you to be service connected. Although, in my opinion, the service connected veteran, that is the primary way, or the highest number of veterans who are in the VA healthcare system are service connected. So that's their doorway in. So I just wanted to share here a few of the qualifiers to get VA medical. So that way you're aware, right? It's important to know what's going on. And what else is important is for those that are not already service connected, you might have a way into the healthcare side so you can get some free care while you're working to get service connected. So just another important benefit, right? It's two different animals. You have the VBA, Veterans Benefits Administration. That's where you would be filing your disability compensation claim. And then on this other side, you have the VHA, the Veterans Healthcare Administration. So this would be an application to the Healthcare Administration. So it's a fairly basic form with basic information, but in the directions or instructions on how to complete the form, there is the part that I wanted to read to you. So one of the ways to qualify for VA healthcare is to be low or no income, right? So means tested. So if your income is below a certain level, then that would be a qualifier for you to get VA healthcare if you have no other qualifiers, like if you're not service connected or what have you. So that's one way. So financial disclosure. So here it says only non-service connected and 0% compensable service-connected veterans must complete this section to determine eligibility for VA healthcare enrollment and or care for or services. So if you are a 0% veteran or you don't have any service connections at all, you need to fill out the income piece. So that part's important. So now it says here also that if you are any of these following, if you have any of these following designators to you as the veteran, so if you have any of these bullets, if they pertain to you, financial disclosure requirements do not apply. Financial disclosure requirements do not apply to these, I don't know how many, 8 or 10 bullet points. So, if you're a former prisoner of war, financial disclosures do not apply. Those in receipt of a Purple Heart, financial disclosure does not apply. Recently discharged combat veteran, I believe that it's a 10-year period. So recently is a funny word. I believe that you can sign up within a 10-year period. So if you've been discharged within the last 10 years and you're not service connected and you need some medical care, you can sign up for medical care. Let's see, those discharged for a disability incurred or aggravated in the line of duty. So you could have been discharged from the military and never filed a claim. You could have gotten discharged for a disability incurred or aggravated in the line of duty and never filed for a VA claim for whatever reason. Those receiving VA service-connected disability compensation, financial disclosures do not apply. And remember, that's for all these. So service-connected disability compensation, in my mind, is the primary way that individuals like us, service-connected veterans, make our way into the VA healthcare system. Those receiving VA pension also can get in without the financial disclosure. Those in receipt of Medicaid benefits. Those who served in an area and in an Agent Orange exposure location. Those who served in Southwest Asia during the Gulf War between August 2nd, 1990 and November 11th, 1998, or those who served at least 30 days at Camp Lejeune between August 1st, 1953 and December 31st, 1987. You are not required to disclose your financial information. However, VA is not currently enrolling new applicants who decline to provide their financial information unless they have other qualifying eligibility factors. If a financial assessment is not used to determine your priority for enrollment, you may choose not to disclose your information. However, if a financial assessment is used to determine your eligibility for cost-free medication, travel assistance, or waiver of the travel deductible, and you do not disclose your financial information, you will not be eligible for these benefits. So, in any case, moving on, it says here, as we scroll through it, it talks about the different, I'm not going to read everything. Talks about deductible expenses if you have to fill out financial information. Also talks about your consent to co-pays and to receive communications. Submitting your application tells you how. You could probably just fill this thing out and take it directly to your local veterans VA clinic, your clinic or your medical facility if it's a bigger hospital, right? The form itself, so it's the first several pages are the instructions, and then the form itself is about, I don't know, maybe 3 pages of basic information that you would put in, and it has yes or no check marks for, have you ever received a Purple Heart? Are you a former prisoner of war? Did you serve in a combat theater of operations after certain times, and blah blah blah. So you would just check yes or no's. It asks you about if you have any current health insurance that you would put in there, and then all right. So Block 1C has spouse information, and then your employment status and so forth, and then your gross annual income from employment. But again, if you meet any of those qualifiers, you're not going to price yourself out of care if you meet any of the non-financial disclosure requirements, so or options. So anyway, just wanted to share with you the Form 1010. That's how you would apply for your healthcare benefits if you have not, and you could print it out, fill it out, and take it with you to your medical facility, and you should be good to go. Thanks so much for watching. I really appreciate you. Have a great one, and remember, if we don't take care of each other, something went wrong.